In this video, we will discuss the most common conditions causing lameness in Irish dairy herds, how these conditions arise, and the steps we can take to prevent them. Most lameness in dairy cows arises as a result of conditions affecting the hoof and the surrounding area. Let's start by examining a hoof. A hoof is made up of a horn capsule within which sits soft tissue and a bone called the pedal bone. Hoof horn is like the human nail. It is constantly growing and being worn down. The hoof horn of the sole grows outwards from the corium to form the sole of the cow's foot, and the wall horn grows from the hairline at the top of the hoof wall. The cemented junction where the sole horn and the wall horn meet is called the white line. This junction is a point of weakness, and many lameness cases arise from injury or damage to the white line. Let's look at the common conditions affecting the hoof that cause lameness that are not infectious. Later in the video, we will consider the conditions that are as a result of infection of the hoof and the surrounding area. Three common non-infectious conditions are white line disease, sole bruising, and sole ulcer. White line damage or white line disease arises when the cemented junction between the horn of the sole and the wall is disrupted. Small stones or grit can become embedded in the white line. If this gritty material penetrates the white line and reaches the sensitive tissue of the foot, there is a painful inflammatory response by that tissue and the cow becomes lame. This can occur at any point along the white line from the toe to the heel. This is the most common condition causing lameness in grazing herds. Sole bruising occurs when the sensitive tissue immediately above the sole horn is subject to trauma. This results in bruising and bleeding, causing pain and can result in lameness. Risk factors that increase the likelihood of white line disease and sole bruising occurring include rough walking surfaces such as roadways, yards and gaps. Cows have a walking order to the collecting yard, but a different order to enter the milking parlour and need space to rearrange themselves in the yard. Inadequate space in the collecting yard can lead to cows competing for space, resulting in foot trauma. It is recommended that there be at least 1.5 square metres per cow in the collecting yard. Inadequate turning distance at the parlour exit, resulting in shearing forces on the foot. Inadequate feed space, causing overcrowding and competition at the feed barrier. A minimum of 2 feet or 600 millimetres is recommended per cow. Allow cows time and space when moving or herding along the roadway and in the yards. They should be allowed time and space to walk without the use of sticks, dogs or quad bikes. Given time, cows will walk with their heads held low, checking the ground and placing the front foot in a safe place. The hind foot is placed in exactly the same spot. Sole ulcers occur mostly on the outer claw of the hind foot. They are caused by a sinking of the pedal bone within the horn capsule of the foot, causing pain, inflammation and lameness. This sinking of the pedal bone disrupts and may even block horn growth, resulting in an ulcer appearing in the sole. How can we reduce the risk of a cow developing a sole ulcer? We reduce this risk by reducing the time spent standing on concrete or roadways, particularly around the calving time. Lying down promotes better overall hoof health, and long periods spent standing are detrimental to hoof health. It's also worth noting cows' hoofs are more susceptible to bruising after calving, so we advise gentle movement of cows, particularly in the first week post-calving. These three conditions are non-infectious, and the required control or mitigation measures are based on cow management, good infrastructure and regular hoof trimming. There are two main infectious conditions causing lameness, namely fowl in the foot, also commonly referred to as foot rot, and secondly, mortellaro, also known as digital dermatitis. Fowl in the foot is an infection between the digits causing severe pain and swelling. It's caused by bacteria normally present in the environment that enter through damaged skin. Treatment requires antibiotics, and the best course of action is to discuss this with your vet. Mortellaro, also known as digital dermatitis, is an infectious disease that affects the skin close to the hoof. It's important to note that many cows can be infected with mortellaro but not show any lameness. Control measures for infectious causes of lameness, such as mortellaro and fowl in the foot, include keeping cubicles, passageways and yards as clean as possible as infection can spread through the slurry. And secondly, disinfecting cows' feet by foot bathing regularly all year round. The key message here is to focus on prevention alongside early detection and prompt effective treatment of lame cows. More details on these areas will be provided in later videos. In conclusion, having a good working relationship with both your hoof trimmer and vet will be invaluable in dealing with the lameness issues on your farm.